Hi everyone, this is Vicky from NP Reasoning, and today I'm going to talk to you about diagnostic frameworks. So, essentially, how to apply diagnostic frameworks to any clinical case that comes in front of you. There is no need to wing presentations when we see patients. We should essentially always be using some form of diagnostic framework to guide us through that presentation. So, again, we're going to learn how to create these diagnostic frameworks for common presentations. It's important to highlight that it's not a one size fits all. So I'm going to present what types of frameworks you can use. And it's really about you experimenting and figuring out what frameworks work well for you given the current presentation in front of you. So let's get into it. So, really, how do we create differential diagnoses, right? We're not winging it, we're not pulling things out of thin air. We use our knowledge base about disease and we create these diagnostic frameworks for various clinical presentations. So, the four common frameworks used in medicine are the systems framework, the mechanisms framework, the anatomic framework, and the checklist mnemonic framework. Again, really important to highlight that it's not a one size fits all. It's really up to you to figure out what framework works best in your brain to organize a case in front of you. And I'll go through many case examples of what I mean by this. So, first off, let's start with the systems framework. It's exactly how it sounds. It's about creating different buckets or systems that can cause different diseases based on the presentation. So, we think about the respiratory system, nervous system, endocrine system, skeletal system, etc. So, for our first case, let's say a 50-year-old male is presenting with a 3-month, so chronic history of bilateral pitting edema to the legs. Instead of just kind of randomly thinking up differentials, I want to make sure that I'm using differential buckets to tailor my history, physical exam, and differential. So, what I ask myself is what body systems can cause pitting edema? So, four key ones that I like to think through are the cardiac, endocrine, hepatic, and renal. And then that other bucket is really for things that don't fully fit, but there's some other random diagnoses that you wouldn't want to miss. So, thinking through this case, for our cardiac bucket, we're thinking of heart failure, restrictive pericarditis. For the endocrine system, we're thinking of thyroid disease, acromegaly, Cushing's disease or syndrome. For the hepatic system, we're thinking of liver disease, liver cirrhosis, certainly cause pitting edema. For the renal system, thinking of kidney failure, nephrotic syndrome, and then that other bucket, there's a few other things listed there as you can see. So, really, I have the chronic bilateral pitting edema. I'm thinking of my differential buckets based on that systems framework. And before I even lay eyes on that patient, I'm thinking through all of these possibilities because this framework, this layout, will help tailor my history and physical exam and tests to order. So it really helps you ensure that you're not missing key diagnoses, right? Let's think of a second example for the systems framework. Say a person's presenting with acute shortness of breath. So, what I like to think about is what body systems can cause shortness of breath, right? Certainly the cardiac system. So, we're thinking of heart failure, acute coronary syndrome, and arrhythmia, valvular disease. For respiratory system, we're thinking of a pulmonary embolism, of course, COPD, asthma, malignancy, pneumonia, etc. Hematologic, could it be an initial presentation of severe anemia? And neurological, thinking of neuromuscular disorders like ALS. And then, of course, our other bucket, as you can see here. So, again, before I'm seeing that patient, I'm organizing my diagnoses or my differential diagnoses based on these bodily systems so I can tailor that differential as I assess. Now, let's think of the mechanisms framework. This is kind of you asking the question, what mechanisms cause X? So let's start with this example. A 20-year-old female's coming in with fevers on and off for 3 weeks. So a fairly long history of fevers. What I like to ask myself is, what mechanisms cause fever? So, of course, there's infectious mechanisms, And that bucket can be broken into bodily systems. So it's a framework within a framework, as you can see. So thinking about, respiratory infectious causes, gastrointestinal, genitourinary, neurologic, etc. My next big bucket is what inflammatory or autoimmune mechanisms could be causing this fever, like rheumatologic disease. Third big bucket you wouldn't want to miss is, there could be many malignant causes, right? So you'd want to be asking about unintentional weight loss, drenching night sweats, etc. Thinking about things like lymphoma. And then the other bucket would, common ones could be a medication side effect if they have a history of substance use, withdrawal. Those are things that you'd want to think about. So again, what mechanisms cause fever? I break it into these four big buckets with the various etiologies, and that helps me ask the questions when I see that person, right? Do you have any chills? Do you have a cough? Do you have a headache? Do you have a rash? Do you have swollen joints? Are you having unintentional weight loss, drenching night sweats? Are you withdrawing from any medication? Do you use any substances? Right. So as you can see, when you have a comprehensive, organized framework, you feel more confident going in to assess that patient. And creating these frameworks for yourself take a lot of work, but it is worth it because it'll set you some solid groundwork for going through your career and seeing these presentations. A second example of the mechanisms framework would be a patient presenting with acute low back pain. Very common presentation, really, regardless of where you work. So, what I like to ask myself is what mechanisms cause back pain, right? We think of neurologic, could it be cauda equina? Could it be infectious, an epidural abscess, autoimmune, like sacroiliitis from ankylosing spondylitis? Could it be traumatic fracture? Could it be a malignant, spinal tumor or metastases? And then lastly, musculoskeletal. Could it fall into that, mechanical back pain presentation? Next, we're going to dive into the anatomic framework. I would say, anatomic framework definitely works well for various pain presentations. That's a common one to utilize for that. So to exemplify that, let's see, classic case of a young male with right lower quadrant pain. So off the bat, you might be thinking, oh, appendicitis. But again, if we wing it, we're going to miss some crucial, possibly red flag diagnoses, right? So what you ask yourself is what anatomic structures in that area can cause right lower quadrant pain. So I like to think of the GI structures, right? For sure, could it be the appendix, the colon? It could be diverticulitis, inflammatory bowel disease, IBS. And kidney structure, could it be kidney stones, pyelonephritis, so that region? And then lastly, genitourinary structures. Could it be a bladder infection? Could it be a testicular torsion, epididymitis, orchitis, etc.? So again, if I were to kind of wing it, I might actually maybe not think of testicular torsion if I'm kind of honing in on, oh, it's the appendix in the right lower quadrant. So again, having a framework helps tailor what you're now going to assess on your history and physical exam. Another example is, patient presenting with chest pain. So you could certainly use different frameworks for this, the systems framework, but you can also use the anatomic framework, asking yourself what cardiac structures can cause chest pain. So of course, we think of the heart, the cardiac area, right? Could it be acute coronary syndrome, valvular disease, pericarditis, aortic dissection, respiratory structures? So could it be a lung pathology, right? In the bronchus, lower in the lungs, like a pneumonia? Could it be a musculoskeletal anatomic area, right? Chest wall pain, costochondritis, gastrointestinal could include the esophagus, the stomach, and the other bucket. So as you can see, just helping tailor your differential before you even see that patient. And lastly, the checklist mnemonic framework, I think we're all familiar with. This is one, sometimes we want to be careful with this one because it can certainly miss things, but the mnemonic checklist framework can easily be embedded on top of another framework that we're using for a presentation, but occasionally it can be used alone as well. A classic one is the palm coin mnemonic. that is used for any female presenting with abnormal uterine bleeding. So in this case, you're seeing an older female postmenopausal with abnormal uterine bleeding. So we think of the palm coin, right? And as you can see, it's spelling out PALMCOEIN and the associated possibilities or etiologies of that abnormal uterine bleeding. And it's essentially breaking it down into structural things that could be causing it: polyps, adenomyosis, leiomyoma, which are fibroids, malignancy, and then non-structural causes like coagulopathy, etc. Last example for this framework here is, person again presenting with back pain. So the nifty mnemonic, which comes from the core back tool, helps us remember those red flag diagnoses we would never want to miss with an acute low back pain or any type of low back pain. So again, thinking about neurological, we're wanting to rule out Cauda-Equina syndrome, people presenting with progressive neurological deficits. Infection, we're ruling out fever, IV drug use, concern for an epidural abscess, etc., etc. So that nifty mnemonic can also be used to help you determine whether there's any red flags for back pain. So, key take home points again, just use these diagnostic frameworks to guide your clinical decision making even before you set foot in front of that patient. As you get better and as you gain more experience and see hundreds and hundreds of patients, you'll know what framework works, and you'll become way more attuned to what you need to ask in those visits. You can use, again, a combination of these frameworks for the same presentation. And again, use a framework that works best for your brain. So it takes a lot of experimenting and figuring out, what your brain's going to remember, and just really experiment with cases and see what works best for you. That's what I've done, in my years of practice, and you certainly get better with it and you refine it as you go along. Thank you so much. Be sure to visit npreasoning.com for more written blog content and other family medicine, primary care updates. Thank you so much, everybody.